Hey folks, Dr. Brett Brennan here with LBT Podiatry. Today we're in the office in our surgical suite doing an in-office procedure on a patient who's had chronic plantar fasciitis. So one of the things that we experience a lot with patients is they've had kind of the standard conservative treatment, which is typically a round of cortisone, stretching, icing, and proper support in their shoes, and their plantar fasciitis pain doesn't resolve. In that scenario, there's kind of a whole level of next options available. Today we're doing a cryo procedure, and what that is basically we have this probe here that gets extremely cold. I believe it's negative 70 degrees, don't quote me on that. We made a small, little tiny poke incision on the heel after numbing her up. We'll stick this probe in, get it right next to that fascia, and then we'll do 2 cycles of 2 minutes on the fascia, which will actually create a little ice ball next to it. The idea is that ice ball, just like if you sprain your ankle, the ice ball is going to help with inflammation that has become chronic. It's also going to help to regenerate the nerves that are damaged in the area. Sometimes the medial calcaneal nerve, or the nerve that's coming to the heel there, can get irritated, and this can help with that as well. Let's take a look. Ready, Tim? All right. Any pain?
Mm-mm.
I'm ready when you are. So this probe is actually insulated in this portion where I'm pointing, and the tip of it has 2 little holes that gases are running through. Those gases interact with the tip, which is what makes the cold mixture. The nice thing about this procedure is typically 3 days post-procedure, the patient is either completely pain-free or just has pain from the actual incisions that we made. 1 week post-op, sometimes they'll have a little spike in pain because they're increasing their activities, getting back to running or whatever it may be. And then 2 weeks post-op, we're typically completely pain-free. We're still wearing those orthotics post-op to help to support the fascia. Great, thank you. But it's a really well-tolerated procedure. There's no downtime after the fact, and it's minimally invasive for sure. So if you could reach through that phone and feel this probe right now, you would know that it's nice and cold. It's not as cold as it is in her foot, but I can feel that it's actually working for us.
Can the patient walk after the procedure?
Yep. So she'll walk on out of here as normal. Maybe be a little bit numb, which will be a pleasant surprise. But yeah, she can walk immediately. And then typically the kind of standard is about 3 days afterwards, you're feeling quite good.
Okay. And what about working out? How long until she can actually get on a bike?
So biking, I'd be fine if she biked immediately.
Okay.
I think working out is a complex question because it depends on the patient's body type and size and weight, what type of workout they're
Impact workout,
Yeah.
if she wanted to be in it for 4 to 6 weeks, you think?
doing. No, I'd be okay with her getting back to that at really 2 weeks.
Okay.
As long as pain is resolved. I know she's chomping at the bit though. You're not signed up for Gasparilla, are you?
No.
Okay.
What type of treatment's required before having this type of cryosurgery? Can you do this first line, or do you usually do the patients usually have cortisone shots before?
Most patients have cortisone shots before. I think it kind of depends on the physician. I think the general kind of rule is that most patients are having treatment beforehand and then they end up at this if it doesn't work. But there's nothing saying that you can't do this as a primary treatment.
Do you need to wear orthotics afterwards?
So this is a cash pay procedure, so I tell my patients if you're paying cash for a procedure, you should have orthotics to set yourself up kind of long term. Excuse me.
2 months.
So now we're in that break period. I'm holding the foot pedal on the floor, which is giving it a break from the cold. As I do this, I kind of lever up against the fascia, so I pull my hand down and I can feel the band of tissue in the bottom of her foot. So we know we're right against it there. Beautiful. Any other questions, Dr. Krawitz?
At the end of the procedure, typically what is it that you inject into the foot?
That's a good question. So afterwards, I use a double strength dose of essentially cortisone and local anesthetic. It'll just help with kind of surgical inflammation, in my opinion. The cortisone is kind of minimizing what we created today. And then we inject ozone, which is O3, so it's oxygen with an attached, O2 with an attached oxygen molecule. It's quite unstable, so after you inject it, it dissociates and hyperoxygenates the tissue. The nice thing about that is connective tissue, which is what the plantar fascia is, doesn't really have great blood supply. So by increasing that oxygenation to the tissue, we're just giving it the best chance to have a great result.
Can the patient take anti-inflammatories afterwards?
Yes. Yep. So I would encourage either ibuprofen or Aleve as long as it's okay. I like Aleve twice a day. You just don't have to take as much as ibuprofen. Yes, absolutely.
When will this patient in particular be able to wear high heels?
When do you want to wear high heels?
I want to wear high heels. I want to wear my running shoes.
Running shoes are our goal.
Excellent. Anything else you want to say about the procedure, Dr. Braden?
No, I know it's incredibly exciting to watch, but I would say, if you find yourself to have a chronic case of plantar fasciitis that's not resolving, no matter how far you are away, give us a call at Healthy Feet Podiatry. We'd be happy to help you out. Thanks, guys.
Thanks, Dr. Brennan.
Yeah.